welcome to our panel discussion on trauma, trauma-informed care across the generations. It's such a pleasure to be here with you all today. I think a good place for us to start as we start a conversation about trauma and how it's affecting the people that we serve across generations, especially in light of the pandemic, all the social unrest that we've been experiencing. Best place to start might be to do introductions and for us to introduce ourselves. So my name is Chad Connor. I'm a licensed clinical social worker from Evansville, Indiana, and currently work at Within Sight, which is a group private practice. I'm a psychotherapist there and a clinical administrator. But prior to working in private practice, spent about 11 years working at a large family preservation agency that contracted with the Department of Child Services. So a lot of my experience with trauma up to this point has been working with people involved with the child welfare system, both as a therapist and as in management. Started off there as a therapist, working my way up into the management role, and was certainly a part of overseeing and leading staff who were serving clients who experiencing trauma day in, day out, but also had the opportunity to help our agency shift towards more of a trauma-informed agency as well. So Lori, you want to go next?
Sure, yeah. Hi, my name is Lori Paris, and I'm an LCSW from New Albany, Indiana, and currently working full-time at VA Medical Center out of the Louisville, Kentucky VA. Also on the side, I do therapy at Associates in Counseling and Psychotherapy in New Albany, Indiana. I am trained, certified consultant in EMDR, eye movement desensitization and reprocessing therapy. So work a lot with trauma. I specialize in working with older adults, but I also work with children, work with all ages. Also an instructor at Kent School of Social Work at the University of Louisville. So been working a lot with trauma-informed care across the past few years. We're really having a movement within VA to be a more trauma-informed care organization. So excited to be here today. Thank you.
Well, hello, my name is Alisa Kaczorowski. I am a former teacher and school administrator here in Indianapolis, Indiana. I spent almost 2 decades working in inner city public schools in Indianapolis, one of which we did a lot of work with trauma-informed care, really certifying a lot of our staff as trauma practitioners, and just making sure that we were using those strategies to help our kids be as successful as possible. The last year or so, I've branched off and now I work as an educational consultant. I own my own business and I go around to schools across the country and basically share with them trauma-informed strategies and how they can create a more trauma-informed culture in their buildings. So I am also a certified trauma practitioner, which just basically means that I can go around and teach all of these amazing educators all of the things that I've learned over the years. So I'm super excited to be here with you all today also, and sharing some of the things I've learned over the past many, many years.
I can't wait to learn and hear what everybody's experiences are and steal ideas and things. So I'm pretty excited about our conversation we're gonna have today.
Same.
Yeah.
Okay, so we have a lot of information to cover with you all today, as you can imagine. The big thing that we want to do is increase your awareness and understanding of trauma and trauma-informed care. We're also going to highlight some communication strategies. So we're really going to talk about working with individuals, families, and also communication within organizations. Another big thing that we're going to do is provide information on how to incorporate trauma-informed care in practice. So in practice means in the classroom with families, working with older adults, and obviously across generations. We're also going to talk about the adverse childhood experiences And hopefully you all will have a better understanding of that as well. So just some tips to remember during this presentation, because, whenever we talk about trauma, whenever we talk about the impact that trauma has on individuals, it's important that you all are taking care of yourselves as we're having this difficult conversation. Be as present as you can. Think about the clients, the students, the families, anyone that you serve, and how these approaches could benefit them. Them as well as yourselves, because part of trauma-informed care is having that self-awareness. So obviously thinking about yourself as well. And then also begin to process the idea of organizational change. So we're going to talk about some individual approaches, but trauma-informed care is looking at change within a system, change within the organization. So it's important to process that as well.
Yeah, absolutely. Points. And this is such an important topic. Obviously, it permeates everything we do. And especially now more than ever with the pandemic, the murder of George Floyd, and the things that we've been experiencing in our country. Trauma is a word that's used and heard quite a bit, both in social work and in broader society. And many people have heard terms like trauma, PTSD, complex trauma, and complex PTSD, but these words can often be confused, used interchangeably sometimes. As we begin our discussion together today, how are we going to define trauma when we talk about that today?
So I think it's important to really think about events. So when we're looking at trauma, what has that person experienced? What are those circumstances? What are those causes of trauma? And looking at how the person reacts to that. So really looking at the experience and the individual's experience of that event. And then with a particular event, really looking at the effects. And I know, clients that I work with, sometimes I'm hearing their experiences and I'm like, wow, this sounds really traumatic, but it might be something that's not traumatic to them. So I think that's something that we have to keep in mind. What's traumatic to one person may not be traumatic to another. And then we also have to think about individuals who have protective factors and coping skills to kind of deal with some things that they experience throughout their lives as well.
When we talk about trauma, we might have a very specific idea in our mind, but a lot of ways it really is affected by, our backgrounds, what we bring to the table, but then also, like you said, what one person experiences as trauma may not be the same for other people, perhaps.
So yeah, one of the things that I often talk about when I'm meeting with teachers and school leaders is that trauma can occur in 3 different ways. And this is, I feel like, a kind of a neat little package to put it in kind of good visual to help you remember. So the first one that we talk about is something that is done to a person. So these are kind of some of the bigger things that we often think about, like whether it's abuse or domestic violence. But this can also be things like natural disasters, things that happen, in our communities, which we're seeing a lot of right now with, some of the social unrest and just the things that are happening in our country. So the second one is something that doesn't happen to a person. It's a lack of something. So that's when we're getting into things like, neglect of a child or food insecurity. They're lacking some sort of basic need. And then the last one is maybe it doesn't happen directly to a person, but it happens to somebody that they're very close with and it directly impacts them somehow. So this could be, a child or really any person who has a parent or a spouse with a serious health diagnosis, or death, divorce, drug and alcohol abuse. For kids, one that I saw a lot was incarceration of a parent. So again, it's not something that directly happens to them, but it impacts them obviously in a lot of different ways. And then, thing that I think is important to remember is that, kind of going along with what you all were saying, trauma can affect people very differently. What may be traumatic to one person isn't necessarily that traumatic to another person. So going along with that, trauma can be a one-time event, but it can also be a chronic state of life. And that really just kind of depends on the type of trauma that a person is experiencing. And also it can be real or it can be perceived. So, you know, an example that I often use is for kids who are, you know, maybe they were living in trauma, they were being abused, for instance, and now they are living in a foster home in a, so to speak, you know, a safe situation. They very well could be still living with that perceived threat. What I kind of like to refer to as like the other shoe is going to drop kind of deal, where they feel like at any moment something could happen to them. They may be in an unsafe environment again. So that's an example of maybe more of the perception of trauma. That's not to say it wasn't real at some point, but now they're in a safe environment, but they're still living with that perception of a threat in their lives.
And also, you know, in talking about all this, we hear about post-traumatic stress disorder so often when we're talking about trauma. And I think the big thing to realize is, you know, with post-traumatic stress disorder, you know, that is a diagnosis. And, you know, a lot of the clients that we work with, you know, have experienced trauma and don't necessarily have that diagnosis. So it's important to kind of think of those things as well. And I know specifically in working with veterans, you know, how easily they can be triggered by certain things. So around Independence Day, when there's, you know, fireworks and things like that, just how they can be so triggered by that. So it's important to think about, you know, triggers that people can have with their traumatic experience as well.
Absolutely. And I think I touch on this later in the presentation and how that, for kids particularly, how certain things can be triggers, and that explains a lot of their behaviors that we see in schools. And it may be an obvious trigger, like you were saying, you know, fireworks. We kind of know that can be a trigger for certain people with PTSD. Sometimes with, you know, particularly with kids, some of their triggers, you have no, unless you know the whole story of what's happened to them, you know, the pieces of the puzzle may not completely make sense until you have that whole story.
So I think we can all talk about the Adverse Childhood Experience Survey. So, and I think the big thing as clinicians, you know, the key to understanding yourself is the key to understanding others. So I know I've taken the ACES survey just to kind of see where I'm at with things, because, you know, when I'm talking about this with clients, it's important for me to know kind of where I am and have that level of self-awareness to better serve the clients who I work with. So any thoughts that you all have about that?
I think it's, you know, it's important to remember that there are so many different things that can happen in a person's life that can contribute to, you know, an increase in ACEs, and then the effects that can have, you know, depending on how many ACEs a person has, or even just, you know, it could be one that was extremely catastrophic, and just really how that can impact so many different things in life, and how it can have the, you know, lasting impacts on, you know, mental and physical wellness, and it really just runs so deep.
Yeah, and just the fact that really, how many people do we actually see that only have one thing, right? Like it's trauma is it's not just a single event. It's things that you know, can be multiple things that have happened over the course of our life and accumulated. But the other thing I think about when when you're talking about taking it yourself is you know, our own lens that we see trauma through when we work with clients, and why that's so important to kind of take inventory of ourselves as well. And given that, especially with some of the comments you guys were making earlier about, you know, what might be traumatic to one person may not be to another, you know, we sometimes make those assumptions or judgments without realizing it sometimes. And so I think that's why this makes this discussion really, really important, not only for us to understand our clients, but ourselves as well.
So let's take a look at what the ACEs includes. So obviously, you know, when you're looking at these adverse childhood experiences, it's important to think about, and as the scale mentions, the recurrent and severe physical abuse, emotional abuse. And, everything that's on the screen, is included in this, but I also think it's important to realize, sometimes people might score very low on this scale, but still have experienced trauma in childhood. So that's important to recognize as well. This is great and so many things are covered, but just because it's a low score, we need to kind of explore more to see if there's anything else that could have been traumatic throughout a person's childhood. And then obviously with this, the higher someone scores, there's been a lot of research done in this area, the more at risk that they are for health problems. The more that they are at risk for, other sort of mental health issues. So as you can see, going up the pyramid, research has shown that, if you have a high ACE score, you are more at risk for these serious health problems, social problems, and then poor life expectancy. So, and I've had clients ask me, I don't know if you all have had the same, but oh my gosh, my ACEs score is high. Does that mean I'm going to die early? And the answer that I always give them is, this is why you're here. This is why we are here as social workers, to help you really with developing those coping skills, really working on these protective factors, to help you through this. So I don't know if you all have experienced that in talking about ACEs with clients, but I know that's one of the questions that I've had a lot.
Yeah, absolutely. It's kind of like, is this a foregone conclusion? And, that, I'm going to have some of these bad outcomes happen to me. And that can also be a great place, an opportunity to kind of weave in protective factors language, things that we can do that we can kind of put on the other side of the scale of what might represent as their ACEs score.
And I think that's why, resilience has become really a buzzword in education, lately, and for good reason. The more resiliency we can build up in our kids by teaching them, whether it's doing specific social emotional learning lessons or just teaching them how to verbalize their feelings so that they can, learn self-regulation techniques, is so important, because the more resilient you are, hopefully the risk, we can get that to go down as they're getting older. So yeah, I'm glad that that's becoming a conversation that schools are having. I think it's really important. So we're going to talk about trauma in children specifically, and why schools should be trauma informed. And I think we've already sort of alluded to this as we've been talking, and hopefully you already maybe have some ideas in your mind of why schools really should be trauma informed. But if we are really looking at some numbers for people who are, mathematical or need some numbers, it's really amazing. And I'll be honest, even looking at these, from 2016, it doesn't seem was that long ago, but having spent the last 6 months going through a global pandemic, I would say these are, very quickly became outdated numbers. But when we're looking at our kids who have experienced at least one ACE in their childhood, we were almost at 50% back in 2016. I mean, now you could kind of argue that 100% of our kids have experienced, have undergoing the pandemic, that they have that ACE under their belts now. So this has certainly changed. But when we translate that into numbers, that percentage, that is actually 34 million kids. So it's a huge number. 34 million kids in 2016 had experienced one ACE. And then if we're, going even deeper into this, it really, our kids, particularly when we're talking about some of, the social issues that we have going on, our kids, particularly of color, are disproportionately represented. So we see these numbers continue to go up for kids who are living in poverty, children of color. So turning now to looking at the characteristics of trauma, and this is certainly not an exhaustive list by any stretch, but you will definitely see different characteristics depending on the age of child that you're working with. Obviously, our preschoolers, or I always say kind of like the 3 to 5 year old age group, are going to exhibit different behaviors than our teenagers would. So there's a lot of overlap in, some of these, but then obviously there are some that are very different depending on the age level of the child. But this can, it goes from things that are more cognitive, like verbal skills and affecting memory problems and our speech and communication skills, to more of the somatic symptoms, the headaches and the stomach aches, to really just, rebellious behavior and aggression toward others. It really runs the gamut. So it can be really difficult to determine, if you're working with kids, is this trauma? Is this, some sort of diagnosis that we don't know about yet? There is so much overlap and it can be difficult, but this is at least a good place to start. If you have a kiddo that you are just kind of wondering about and wondering if something is going on. So then how does trauma impact learning? So I talked just a second ago about some of the cognitive issues that we see in kids. One of the things that I like to talk about is learning brain versus survival brain. And I always say it's sort of like a really long bridge. So learning brain is really where we want all people to be. And you can make the argument that this is for adults as well, not just kids. But learning brain is really when it's the ideal. It's where we want everybody to be. They're calm. If we're talking specifically about students, our kids are coming into the classroom, they're ready to learn. They're open-minded. They can kind of see things from other people's perspective. Even just their body is calm. They're at peace. They can communicate easily. But then when we're looking at kids that are undergoing or experiencing trauma or have experienced trauma, these kids are on the opposite end of the bridge, which is survival brain. This is where they're anticipating a threat. They may have difficulty communicating with you. They're stressed, they're tense, they're anxious. You can see it in their bodies. And the longer kids spend in survival brain, the harder it is to get them back to learning brain. So thinking about it like a bridge, if they're all the way on one side over here in survival brain, it's much, much harder to get them back over to the other side. Or they can be somewhere in between, anywhere on the spectrum. But we really want to make sure that we address it as quickly as possible so that we can get them back to that ideal that we want them to be at. Trauma really can impact brain development in so many ways, especially for our really, really young kiddos who are still in the stages of their brains developing. So there are so many different things that happen, and I will certainly not read through all of these. You can kind of see some of these are highlighted. Those are the things that you're really going to see, or you could see as impacts. But as all of these different hormones are released in your brain, so many different things can happen. It can affect a kid's cognitive ability, their memory, their executive functioning, their speech. We talked about some of these, the ability for the different sides of their brain to collaborate and work cooperatively with one another, their ability to self-regulate, their response to things that happen in their lives. It really just runs the gamut of so many different things. And so, that's not to say that all of these are going to impact every kid who experiences trauma, but this is sort of the list of things that could potentially, you could see, especially like I mentioned with those younger kids whose brains are still developing. And then on the flip side, if you are working in a school or you're working with kids, these may be some of the things that you see as a result. So their inability to manage and self-regulate, manage emotions and self-regulate. We're at an increased risk of physical and mental illness, like Lori talked about earlier. But even things like developing unhealthy relationships and distrust of adults or people in general in their life. These are all things that we need to be on the lookout for. Some of these are learning issues, the ability to memorize information or process information, analyze information. These are all things that, teachers or school leaders or social workers, all the people working in a school that are working with kids may notice. And it's important to remember that these could be the result of trauma. All right. So then kind of turning to look at behavior a little bit versus our learning. So when we're talking about a kid's behavior, I think it's important to think about private logic. And private logic, is really just kind of a fancy way of talking about how a person just perceives the world around them. It's what they believe about themselves, it's what they believe about the world, it's what they believe about the people around them. That's shaped by all of the experiences that you had in your life, the environment that you were raised in, the society that you live in. So all of those things can shape a perfect person's private logic. Well, likewise, a child who's experiencing trauma, their private logic is also going to be shaped by that traumatic experience or event or state of life. And in turn, this private logic then drives their behavior. So thinking about, those kids, say the access to the language areas of their brain is limited because of the impacts of trauma. They're not going to be able to communicate effectively with people around them. So often kids, and we know this kind of in general about kids, right? If they are unable to communicate their needs or whatever it is, then they often use their behavior as their means of communicating. And so, it's really important that we look for those behaviors as clues to us to kind of figure out what's going on. If we kind of have that sense that maybe something is going on, or we have I would say the red flag has been raised, and you just have a feeling that maybe something is up. We can learn a lot about kids by the way that they're behaving.
All right. Yeah. I mean, hearing you talk about that makes me think of the adults that, that I work with and see. I work with kids, but also it's just wonder by the time that they become adults, if, especially those who have had the complex trauma where that's just been layered for many, many years. And if it hasn't been addressed, seeing people in your office who really almost don't know what it feels like to be completely, like just to feel safe and kind of calm, because all this stuff is kind of going on and happening. And that limbic area of your brain is just constantly activated. Obviously, as we shift over to kind of talking about families, one of the ways, actually many of the ways that trauma affects families is we think of families as, or at least I do, as my client. Like the family unit is the client. So if we think of it rather than a collection of individuals, instead as a symptom, a lot of what we've been talking about with ACEs and things like that obviously impacts families as well. And so some of the big things that, maybe we haven't touched on as much, but can certainly impact and create stressors for families and trauma is, in addition to some of the things that we've talked about, obviously alcohol and drug use. You've got one person that's using, that affects the whole family. In terms of what roles mom or dad play in terms of parenting, or even the children, if they are parentified as a result of having an absent parent. Moving and dislocation, that's something we see a lot of too when I work with families is, we don't always think about that as being traumatic, but, it's traumatic for everybody, whether it's switching a job or, kids learning to get acclimated to school. Moving and dislocation is something that we see, but then also community violence, and that is a trauma that experience day in, day out in families. In terms of, is it safe to let my kids go play outside? And are there, am I worried about a bullet traveling through my window or my wall? Gang violence, things like that. All play a role on family trauma and the stressors that they experience that really sometimes don't go said, and sometimes is also acknowledged as just kind of normal. And that's a big thing that we see with families too, is generational trauma, where these experiences kind of happen and trickle down through the course, echo through time, through generations. Whether it is poverty, homelessness, drug abuse, et cetera, we see those things kind of repeat itself through families, unfortunately. It's also worth mentioning really what we're all going through right now together, and how that's having that impact on families as well. Because even though we are 6 months plus into this pandemic, again, as Alisa had mentioned a few times, trauma affects people differently. Some things are more traumatic for people than others, but collectively as a society and on our families, this is having a cumulative impact that we don't always necessarily recognize. And the NASW actually back in April did a, actually, I'm sorry, it wasn't the NASW, it was Kaiser. They did a poll back in April on how the pandemic was impacting families, which of course that's severely outdated compared to now. But even back then, 55% of workers lost job or income since February 2020. So in, of course, a couple months, 55% of folks, were experiencing some sort of financial insecurity as a result of that, which of course impacts families. If mom and dad are stressed at home, that could have impacts on obviously the kids in terms of just having the extra capacity to parent and the way that we should. And there's been a lot of concern about whether or not abuse neglect rates are actually going up quite a bit, and we just aren't fully aware of those things because in addition to the additional stressors families are experiencing right now, your traditional reporters like schools, daycares, and things like that, they're not seeing the kids. They're not working with them directly. And so really it's a lot of us social workers who are still seeing people in therapy, who are doing home visits, who are working in various capacities in those ways. We're on the front lines of trying to recognize those things and how the stressors of the pandemic are impacting families. So I think that's something that's really important for everybody to be keenly paying attention to is any signs of abuse, neglect, or just ways to support families as they're going through really tough times in general. But 42% of all adults back in April reported that that they had lost their job or had a cut in salary or hours. 29% fallen behind on paying bills already. Of course, I'm sure that's gone up in recent months. Of course, 56% of U.S. adults said that worry and stress was leading to experiencing at least one negative effect on mental health and well-being. And so certainly I think I would imagine all of us are seeing that on this panel. And I'm sure you all who are listening to this right now have seen just day in and day out the impact this is happening on individuals. And certainly that has a big impact on families almost goes without saying. So the NASW also issued a social justice brief with some resources a few months ago as well, and basically trying to identify some of those areas where the pandemic is hitting the most vulnerable. And so this is just a short list here. I won't read through every one of these, but it's worth searching out for those of you who are NASW members. Not only some briefs on how this is affecting our clients that we're working with, but also some resources on how we might be able to support our clients during this tough time as we're going through the pandemic. As far as the way that trauma can disrupt the family, Alisa was talking a lot about how trauma can affect an individual child's brain and their behavior, and thinking about the family as our client and its own entity. Trauma can disrupt several elements of family life as well. One of those being a sense of safety. So that one is kind of speaks a little bit to what I was talking about with the pandemic. As people become stressed, it might be people might turn to one if someone's working multiple jobs to make ends meet, or there's a disruption in employment or an increase in substance abuse, safety becomes a major issue in families. Basic needs being met, as we've been talking about, and then roles, power, and alignment. So what we notice in families is basically a quote unquote healthy families, you would have an adult that basically is responsible for setting rules and making sure everybody's basic needs are met in the family in terms of the kids and the younger family members and things like that. But what we see with trauma is that structure gets disrupted. Where sometimes, again, if you have an absent parent or absent parents, you might see kids step up in the parentification role, where they're providing a lot of the roles and serves the roles that a parent would, which certainly leads to negative impacts for that individual child that's parentified. So that can definitely impact roles in terms of the dynamic of who is doing what in the family. As well as values and beliefs. So what I mean by values and beliefs is, especially with generational trauma, is the idea that you know, that we, you know, kind of, it's always been this way, and we almost don't even recognize sometimes our own trauma that we're experiencing. There's kind of a lack of sometimes just a feeling that we can achieve, right? That my kids can graduate high school, or you know, what a healthy, loving relationship looks like, things like that. Trauma impacts those things in families. And then affect, involvement, responsiveness. When we're under stress, it's a lot harder for us to, especially when our limbic area of our brain is activated, and we're kind of in that fight or flight mode on some level at all times. It makes it even harder for us to exhibit empathy towards each other. And that happens in families too. So if I'm a parent that's stressed out about, you know, my next paycheck and being able to pay all the bills and just to make sure that we have the lights on and things like that, it gives me a lot less capacity to be able to understand why my kid is having a temper tantrum, and that really, that temper tantrum is a signal of need and not that they're a bad kid. So obviously that impacts how discipline works, you know, basically using corporal punishment versus redirection, things like that. So just having that affect involvement, being able to be empathic towards each other within the family, trauma can greatly disrupt that and make that harder for family members to connect and to support each other. And then basic problem solving in terms of solutions and solving issues like, you know, how do we make sure the kids are cared for after school, you know, now that dad's got a new job, etc. Lisa was talking about family resilience. This is something that also in the realm of family preservation has become a lot more focus. What that means in the context of the family is family resilience is the family's ability to maintain or resume effective functioning, including care of its members following potentially traumatic events. And so another word for this might be bounce. So bouncing back when we have something bad happen to us is another way of looking at this. And ways that we can get at trying to improve family resilience is looking at beliefs and attitudes towards you know, each other, towards relationships, towards what we're capable of doing. Routine versus flexibility. You know, families who have limited resilience, or you know, who have limited resilience, we notice that they're a little bit more rigid in their routines, and they kind of favor routines, and this is the way that things have always been, over flexibility. And so that is that's something that we can do with families to try to improve their ability to improve their resilience, is to kind of work with them on flexibility and versus rigidity. Problem solving, and then communication. So not only just like that we're communicating more, because a lot of families don't have any problems communicating, it's what they're communicating. You know, we might yell, we might raise our voice, or what have you, but again, it's that affect involvement. It's trying to really kind of understand the function of everybody's behavior in the family, what role they play, and each person's needs and desires, and how we can help each other meet those needs. And so communication is really important. That information sharing and affect involvement is a big part of family communication. So when you add all those things up, and when we focus on those things as practitioners, as a social worker, as an educator, etc., that can help us move a family towards resilience. Some additional things that we can do to support that: reducing the number and intensity of stressors, which with the pandemic, that's really hard to do. That's one of the ways that we feel like our hands are tied. But increasing and improving coping strategies, increasing access to resources, and reappraising the situation and adjusting expectations of the situation and or themselves. So in some ways, it's like doing that old cognitive reframe of like what's going on, you know, that you know, we're all trying to help them kind of look at their situation from another perspective that might provide hope or a solution possibly, versus feeling like there's no hope or no solution to what we're dealing with.
Okay, thank you. So you all have covered so many great points, and obviously with older adults, you know, they are experiencing a lot of the same reaction to trauma. But I want you all to just kind of imagine for a second, and this is how sometimes I describe trauma, is we all carry a backpack and nobody knows what's in each other's backpacks. And as we go through life, you know, weight is added to that backpack. And so sometimes along the way, we may be resilient, and we may be able to work through some of what's in our backpack and release some of that weight. But sometimes we never do. So in working with older adults, when I see someone who is close to 100 years old that has experienced so many things in their life, it's very, very hard because they're carrying so much weight. And obviously, you know, with older adults, you know, someone who is 100 years old and they've experienced all of this, they're now experiencing facing the end of their life and dealing with, you know, everything that kind of goes along with that. And sometimes they handle that well, and sometimes that's very, very hard to deal with end of life issues. So I just want to kind of highlight how it might look a little different with older adults, and then also talk about, you know, some other things to kind of bring up that's a little bit different. So with older adults, a lot of times, you know, they might not come into a therapist office and say, you know, I am feeling depressed today, because obviously when we're looking at older adults, we're looking at a generation of individuals who see mental health issues as it's a stigma for them. So they don't want to be labeled, and you know, they maybe have grown up to think you can handle this. And this is where we get into different cultures as well, and thinking about all of these factors. So with older adults, sometimes, you know, it's affecting them physically. So seeing more somatic complaints, you may notice with older adults a decrease in appetite. You may notice, you know, increase in just complaining of pain. And this is where it gets really tricky with older adults, because, you know, there are medical conditions that could be happening as well. So it's almost like putting together a puzzle and figuring out, you know, what is happening, what's causing what. Is this a medical condition, or is there something else? Also with older adults, we have to think about cognitive impairments. So, you know, I work with veterans, and veterans are mentioned on the screen right here. But a lot of times with veterans, you know, if they have dementia or a neurocognitive disorder, they're not remembering maybe something that happened earlier in the day, but they're remembering their past. So I see, especially with veterans, a lot of veterans who are remembering their wartime experience. And, you know, in talking to maybe their families are very surprised by that, to say they have never talked about what they experienced in war. But with their dementia or neurocognitive disorder, you know, these memories are coming back, those long-term memories. And it's almost like these older adults are being re-traumatized by what they're remembering, which can make it really, really hard. And then older adults, there's been some research done that those who experience trauma later in life report more avoidance, more sleep problems, and hyperarousal than younger adults. And I mean, keep in mind, you know, even though they may have had trauma from their past, so this is where ACEs comes back in, because, you know, maybe they did experience trauma as a child, but, you know, they also can be experiencing trauma in the present. I remember working with an 85-year-old who experienced a home invasion. So obviously working through that present trauma brought a lot of trauma back from her past. So it became very, very complex. So thinking about that as well. And then I want to touch on, you know, older adults who may be in a facility, may be hospitalized. This is where we kind of get into that organizational change that we're going to be talking about, and how important that is. Because when older adults have caregivers, and when they have people working with them that may not know their history, may not know them very well, they may say, oh, this older adult is having behavior problems. And, you know, there was a story one time of a woman in a nursing home who, she had her baby dolls, and she had to go through this ritual every night with these dolls. And, you know, a lot of people in the facility thought that she was delusional in doing all of this. Well, when a social worker sat down with this individual and really talked with her and really obtained that history, come to find out this older adult had several miscarriages throughout her life. And this was her way of healing. So that is the big thing that I want to mention in working with older adults or any population that we are serving. Don't be too quick in saying it's a behavior. Don't be too quick in saying, that's a very deficit perspective. We really want to move towards a strengths-based perspective and getting to know the person. This is where we get into effective assessment skills and understanding a history. And, of course, it's hard because some people might not be willing to talk about their trauma in the beginning, and when we're doing a psychosocial assessment, we're trying to understand what a person has been through. Sometimes they may not tell us. So, it's developing that rapport and constantly doing an assessment, because when they do feel comfortable, anybody across the lifespan, and they trust us, they're going to feel more comfortable in telling us what they have experienced. And I do know, the what not to do is, saying to somebody, tell me about your trauma. Like, I understand you experienced, war and you were in Vietnam. So tell me about your trauma. That's kind of the what not to do. Like, give them time, because even that question can re-traumatize somebody. And this is where we get into flooding and bringing back tons of memories just in the way that we're communicating with an individual. So important things that we're going to talk about as we branch into strategies, and we're really talking about trauma-informed care. But I do want to say with older adults also, I work a lot with their caregivers, because their caregivers are key in helping to manage some of what's happening and having that understanding, and the caregiver being trauma informed themselves.
Yeah, absolutely. And as far as thinking about, like, I don't know, all the people that we work with, the populations that we've just been talking about, I'm kind of wondering what you all think, like this current, the pandemic, maybe we'll start there, like with COVID-19, how that is impacting the people that you all serve and work with as we're talking about trauma.
Well, it's funny for me because I get this question a lot from schools, to the point where now I just address it before I get the question. Do you consider the pandemic to be, a trauma in ACE, so to speak? And I say, absolutely. Let's think about the ways that this is affecting anybody, not just kids. But and I could sit and tell story after story about how my own children have been affected, and they're living in a very stable home environment. But not only all of the things that Chad mentioned with adults and what were the massive job loss and inability to pay bills and just the stress that comes along with all of that. Our kids have been socially isolated from anybody that they really care about other than their family for close to 6 months. I know we're starting to get out of that, but even so many of our kids are e-learning still. I know my own kids still have not gone back to school, so they have not really gotten a chance to see their peers or all of those trusted adults, other than through a computer screen. And so how that affects them social, emotionally, the inability to get outside and play at playgrounds for so many months, and just all of those things, that their world has been turned upside down. All of ours has. And so absolutely, this is a major trauma that is affecting everybody, kids, families, adults, every single person in our society, really, really deeply right now. And we don't really know where it's going to go. Like, Chad, I think, mentioned our hands are tied at this point. Like, we have no idea what's next, or, what's coming. There's just so much uncertainty. So absolutely, so much trauma surrounding this pandemic right now.
Yeah, really good points. And I can say with older adults, it's been very traumatic, because if they are in a facility, you have all these restrictions of having visitors, and their family members are having to visit them outside of a window. And, even recently, there was an older adult close to the age of 100, lost his, very close loved one, and really couldn't go to the funeral because of, the fear of him getting, COVID-19. So it's been really hard, with older adults. I think the social isolation piece and coming up with creative ways to make sure that they are connected. So this is where we get into video visits. This is where we get into, making sure that technology is playing a role. So at least there is that connection. That's really important. But it's definitely been really, really challenging. And again, this is kind of where we as social workers go back to our own self-awareness. How are we dealing with it? We have to kind of take a step back and process some of what's happening ourselves so we can be more effective for those that we are serving.
Yeah, and even just not only the impacts of the pandemic itself, but I think I talk with so many people who are wrestling with social distancing. It's like I'm social distancing, but my friends aren't, or vice versa. And just the, I don't know, just the relational trauma that's happening right now, right? Like in some ways, it feels like things are more divisive than they've ever been in many ways. And then you add into this that there's even how we're dealing with this pandemic in a lot of ways is causing a lot of stress on families and people that we work with. It's just like almost every other person that walks in to my door, it's there's a lot of frustration, angst with family members who don't see the way to deal with this the same way that they do, and it's causing not only their social distancing kind of happening where people can't physically visit, but sometimes people are kind of they're getting rubbed the wrong way by the people that they care about the most, and they've had close relationships with, just on how we're all handling this. So it's just a thick feeling out there, that we're kind of helping walk people through right now.
I talk about something similar with, in schools, that the level of information that, particularly when I'm talking about kids, have been given could vary vastly. And so, as kids are returning to school, for those who are returning in person, that's a whole other set of challenges for the social workers and educators and staff in schools to deal with, because you just don't know what level of information kids have been given, and then that translates into a level of fear sometimes for kids, and how to go about just kind of wrestling with that in schools right now is really tricky also.
Yeah, and for, I'm sure, children and, older adults, those that might not understand, when I do home visits. So now when I'm going into a home and I have a face shield on, I have a mask on, I have all of these things, and they really don't understand what's happening, that itself can be traumatizing. And I think too, seeing older adults, and for all of us, just missing that physical touch. And I don't know if you all saw a clip of, it was a grandmother who basically covered herself in plastic so she could hug her grandchild. And so just seeing that, I mean, it's heartbreaking to even talk about. So, I mean, seeing it is hard enough, but what everybody is experiencing internally is just very, very sad. And I think it will have an impact for a long time to come.
How about the civil unrest with what's happening with the protests and the murders of people of color that really spurred a lot of conversation and protests in our country? Like, how is that affecting maybe the populations that you guys work with?
I think for me it's very similar to the pandemic, as far as how much information do kids have about what's going on, in their own communities or, more globally, and what conversations are taking place in the homes is really going to impact, obviously their perspective on things. And so then, kids take that back into the schools, and whether it's, inappropriate comments or them just, saying things that they've heard, is really something that I think educators or anybody who's working in a school is going to have to be very cognizant of. because it has been very divisive, like Chad mentioned. And, you know, that translates to all of the families in a school. Not every family in a school is going to be on the same side of, you know, an issue. And so then kids are coming with that background knowledge, or, you know, some have watched the news, others have not. Some may have no idea what's going on. It's really going to be, again, a tricky thing to navigate for schools.
Yeah, and I'm here in Louisville, so, you know, with the death of Breonna Taylor and, you know, all of the protests and things happening, it's been very, very hard, just because, you know, we need justice, and these things are happening. And I think, you know, especially for older adults, it's bringing back a lot for them. And then even, you know, turning on the TV sometimes, it's like, oh my gosh, I mean, you're seeing what's happening. And I think that itself can be very traumatizing. I think also for me, you know, I've been communicating more and trying to understand different perspectives, and I think that's where we have to be sometimes. Sometimes people are scared of what they can say and what they can't say, but like I tell everybody, I'm learning. I want to learn. I want to understand, and I want to be a more effective social worker. So what can you teach me that will be helpful for me, you know, throughout my career?
I think that's one of the things that I find kind of challenging sometimes, and I have to watch, you know, myself. I know something that my colleagues talk about too, is obviously we've cared a lot. I mean, as social workers, as a profession, systemic racism and these things have been things that we have been addressing. You know, it's why we exist. But now this is kind of in the forefront again. And so people come into our offices, you know, maybe with very different views on that seem to clash with our professional values at times, you know, one way or the other. And so I think sometimes, you know, trying to find the right approach and intervention to effectively work with people and using the right communication, like you said, maybe kind of from a learning posture, you know, how do we, you know, work with those folks who, are traumatized, but maybe in a different way than what we're even talking about. They're obviously people who work in law enforcement, and who, and not that, you know, it's necessarily a them versus, you know, one side or the other type scenario here. I think that's the way things are painted a lot in society, but, you know, you have very strong opinions on both sides, and that's who we work with. You know, we work with everybody. And so I think that's something that, as social workers, I think, is part of the trauma we experience. The vicarious trauma sometimes is kind of how that's affecting the people that we work with, and also at the same time trying to, you know, make sure that we're adhering to our values as a profession, while at the same time culturally sensitive, and at the same time trying to walk alongside where people are. So I know that's just been a big challenge for myself sometimes, and I'm sure maybe perhaps for you guys as well.
So maybe we should shift and go into strategies to talk about trauma-informed care, and how we can take a more strengths-based approach into everything that we've talked about. I think it's a nice branch into where we're going, and what you all can use. And I know just being on this panel with you guys, I've already learned so much that you all have had to offer today as well. Okay, so we're all going to talk about this, and, you know, I won't read this definition. It's on the screen here for you. I think it's important that all of us identify what trauma-informed care is. So from my perspective, I see it as it is an organizational change. I know a community change. Here in Louisville, we actually have a SAMHSA grant to become a trauma resilient community. So it starts on a big level. And I do know, like here at VA, like I say, you know, as soon as a veteran pulls onto this campus, you know, we need to be trauma informed. And that is from, you know, the time that they check in with someone checking them in, to the time they see a clinician, to the time that they may interact with an environmental service worker. It is everybody having an understanding that we don't know what a person has been through. They don't know what we've been through. Even our coworkers, we don't know what they have been through. So keeping that in mind and always remembering that point, I think, is important. And that's how I would describe it. What about you all?
Yeah, I think it's very similar. I think you hit on a lot of things that I believe for schools that, I think trauma-informed care it's a culture in a school. It's a culture that you have to build. And in order to build that, everybody has to have a knowledge base. Everybody has to have a foundational understanding of what it is. And that's one thing that I always, talk to schools about, is that everybody has to be on the same page. Everybody has to have that understanding, from, your cafeteria workers to your bus drivers to your front office staff, your educators, your maintenance staff, because educators already have a lot on their plates, obviously. And, and they're lucky if they have a social worker in their building or a school counselor in their building. Unfortunately, that's considered, lucky these days in schools. And so they really have to have that understanding, because that's not necessarily their wheelhouse. And so everybody kind of needs to have that foundation and understand what it means to have that culture and what strategies then can be used with kids.
A big part of like what I think about too, when I was in management, is really thinking about the parallel process, because we have to have our staff be trauma informed. They have to have that competency. But quite frankly, because of the populations that we work with, it can be very challenging working with trauma. And it can, like you said, with educators being burdened in so many ways, that we have to be very mindful of our staff's capacity to be able to work with trauma. And so a big part of it for people who are in supervision and administration is really recognizing the fact that our staff are traumatized as well. And so being a trauma-informed agency is not only, which of course a very large piece of that is making sure our staff have the competency to work in such a manner, but also making sure that our culture and our management style, the amount and level of supervision we provide to people is reflective of kind of that value of being trauma informed as well.
Yeah, and I think, having as much knowledge and awareness is so important, but I think sometimes people think, well, I've been through a training on trauma-informed care, so we're a trauma-informed care organization. It is a continuous process that has to be reinforced. So I know here at VA, we've talked about, really including this into new employee orientation, because you have new employees coming in all the time. And I think the bigger the organization that you are, the harder it can be sometimes. But it takes more than just a simple training. And I can say for older adults, and I'm so excited about this, the Center for Medicare and Medicaid actually have in their regulations now that everyone who works in a long-term care facility has to go through training on trauma-informed care. So that's a step in the right direction, I feel like, but even with that one training, it's something that constantly has to be reinforced. So I think we can all probably relate to this. We're trying to kind of move from that deficit-based into a strengths-based. So you don't want to say what's wrong with you. It's more of what's happened to you. What have you experienced, in your life? And I think a lot of times when we're talking about trauma-informed care, people assume that it's a treatment modality. And even though, it may encompass some of that, it's like everybody was saying, it's an organizational, it's a culture change. So it's important to, hit everybody on every level, because I know a lot of times somebody who is a bus driver or someone who is not a clinician, they'll say, well, I'm not a clinician, I don't have to understand this. But, being trauma informed, you don't have to be a clinician. We're talking about everybody on every level. So any other points you all want to make on that?
I'm just going along with, the top bullet, like what happened to you versus what's wrong with you. That's something that I stress with educators, asking why. Going back, we've talked about the behavior and how that can really, be a characteristic of some sort of trauma. And so I always encourage anybody who's working with kids, asking why. Why is a child behaving this way? And then trying to reframe that behavior, not as, this kid is just here, to push my buttons. Well, no, probably not. How can you reframe that behavior and make it work for you in your classroom, in your school, in your, small group that you're working with, whatever it is. So I think it's really important to ask why. Why are you acting this way? Why are you behaving this way?
Yeah. Well, and I think another thing too is just, using language that kind of respects kind of people and how they've adapted, right? So like, in addition to kind of what's happened to you, is, kind of adopting that view that, our brains do kind of slant towards health, like, may engage in behaviors sometimes that seem as kind of, we call them maladaptive behaviors, but like things that are antisocial or might get people in trouble with the law, whatever. But it was adaptive for them at some point, may not be in this situation. And so that's helpful for us because then it kind of gives a function to the behavior, as we've been talking about, in terms of trying to understand its context. But also sometimes it can be helpful to use that language when working with clients, because there's a lot of shame that comes with trauma too. Like, they, many people who experience this are not happy about their situation or about the patterns that they're stuck in. And so using that language and that perspective is that like, this is a survival strategy that has worked for you, but is not working now. We just need to figure out how to shift gears in a lot of ways can help provide that context to clients too, and kind of gets to that what happened to you mentality as well.
So let's look at the 4 R's in trauma-informed care, and this is actually from SAMHSA. So this is kind of summarizing some of what we're talking about. So with trauma-informed care, realizing the prevalence of trauma, and again, this is everybody at every level. We are talking about the culture change. And then recognizing how trauma affects individuals involved with a program, organization, system, including its own workforce. And then basically responding by putting this knowledge into practice, and then resisting re-traumatization of veterans, children, older adults, families, all that we serve is really what, we want to emphasize. And again, when you think about a culture change, this is your coworkers, this is leadership, this is everyone, because, even though you may have these practices in place and you have a good understanding of trauma-informed care, but your coworker doesn't, and you're coming to work in survival mode every day because you're getting that, re-traumatized, then there is a parallel process, like Chad mentioned, and it's going to impact on every level, and it's essentially going to impact those that you serve. So there's 6 principles to trauma-informed care. So safety, does someone feel physically, emotionally safe? And then there's that trustworthiness and transparency. Do they trust their employees? Is their interaction respectful and professional? There's a level of peer support, collaboration. So, can individuals, can clients, families, children, can they be involved in the process of their care? And empowerment, and that's huge because we all need to be empowered. And those clients that we serve definitely need to feel that level of empowerment as well. So this goes along with having a voice and having a choice. And, are we really considering our clients what they do want? And are we helping them get to the level of feeling empowered to make a change? And then also, obviously, keeping in mind the cultural, historical, and gender issues that we've also touched on in this presentation. Communication is important, don't you all feel? Obviously, yes.
Yes, absolutely. Yeah.
Go ahead.
Everything from kind of how we talk about trauma, but also like the more comfortable we are talking about some of these things, obviously the more comfortable our clients are going to be too. But then also just making sure that we're using language that is respectful of people's experiences.
So the next slide kind of breaks it down, and I love this slide because, we're trying to move from a deficit perspective to a trauma-informed strengths-based perspective. So the column to the left is not where we want to be. And, you know, if you ever catch yourself saying something like, my borderline client or my manipulative client, like take labels off. We're moving away from that. And hopefully today in talking about trauma, you know, you're thinking deeper of, you know, maybe it's really not these things. And, you know, maybe like Chad had mentioned and Alyssa has mentioned, you know, throughout all of this, like this could be an adaptation. You know, maybe they are having this symptom or having this, as we call, behavior, because this is how they've adapted to a trauma that they've experienced in their life. So having a better understanding, I think, is so important. And I won't get off on my tangent of how I feel about personality disorders, but in working with trauma, my way of practice is I steer away from them until we really treat the trauma and see kind of what's left over before I even consider going down the path of a personality disorder.
I think this is so important also in schools. I talked about this a little bit earlier, but it's really easy for anybody who works in a school to label a kid. I mean, that has become part of our society with kids, right? Is we give them labels. And sometimes that's necessary, and rightfully so. And I'm not saying that we shouldn't. But again, I mentioned this earlier, the characteristics of trauma so overlap with the characteristics of so many things, ADHD being one of them, and it's so difficult. And it's not the job of the teacher either to, you know, figure that out, but also they are the ones spending 7 hours a day, you know, with these kids. And so this is definitely something that I talk about with schools a lot, and really encouraging them to start looking at the kids from a different lens and, like I said, reframing the behaviors, their perceptions. So we're not talking about, you know, the ADHD kid or the hyperactive kid or that kid who is, you know, always poorly behaved, and just encouraging them to look at it from a different lens.
And don't you think too, it's important, I mean, obviously to look at the environment that they're in, because I know I see a lot of children in private practice, and sometimes, you know, it's like the parents are saying, well, they're having this horrible behavior at home. And so I always think, like, what's going on in the school? And when you explore that more, it's like, okay, what's going on in the home or what's going on in the school? Because it's only happening in one place. So let's take a closer look at the environment.
Absolutely. We see that a lot. We see that a lot in schools, that things just don't seem to jive. And yeah, and that's why, you know, constantly asking why and trying to dig deeper. You know, I think Lori, made the puzzle analogy earlier. I use that all the time. Also, you know, figuring out a kid in their past and what's in their backpack is like putting a puzzle together. And if you get really lucky, you'll get all the pieces at some point. But 9 times out of 10, you probably won't. And you're doing the best that you can with the picture that you have. I think that's a really important point.
Yeah, and it brings to mind the idea of generalization too, because especially when talking about kids, because you know, what is adapted from them in one environment may not be another, or they might learn coping skills they use at home or in other places, trouble implementing that elsewhere. So in addition to that being a clue on maybe where some things are maybe not either where they might be experiencing trauma, it also could be a function too sometimes of them needing some extra support to figure out how to use whatever it is that they're using to be adaptive in other situations, in other environments, because that's trickier for kids sometimes to translate that from one environment to another, especially when they're experiencing trauma.
So I love this. So for those of you who like to read, Sandra Bloom has some awesome books out there that really talks about trauma-informed care. And so this is her quote: trying to implement trauma-specific clinical practices without first implementing trauma-informed organizational culture change is like throwing seeds on dry land. So I think her books are amazing: Destroying Sanctuary, Creating Sanctuary. And when you're reading these books, you really have even a better picture of trauma-informed care. So I have to give a shout out to the Sanctuary Institute and Sandra Bloom. So, okay. Obviously, when we're looking at a culture change, you know, it's leading and communicating about the transformation process. So those of you who are listening to this today, you may not have a leadership role within your organization, but as social workers, hopefully you are feeling empowered with the knowledge that you've obtained today to try to approach this topic in your organization. A lot of times it does start with us because, you know I've asked the question in organizations before, like, tell me what you know about trauma-informed care. And I've kind of done my own little qualitative research, and some people say, well, I heard it's a new buzzword in the field, or, isn't that a specific intervention? So with social workers having this knowledge, I think we are the first people to kind of start this. And I know here at VA, it started as a conversation with a couple of social workers, and it grew. We started having more people on board to what our initiative was going to be. And then it made its way to leadership level, which is where you want to get it, because that's where, change can happen. So any points that you all want to make? Because I know we all come from different organizations.
I can't underscore enough that kind of idea of making sure that you have buy-in at every level. When you're wanting to do evolve into a trauma-informed care organization. So like there's that, but like kind of like you were saying too, is thinking about what your sphere of influence is, or whatever position. You don't have to be in management to make changes. As a manager at that family preservation agency I worked at for a few years, it was very evident to me which of our team leaders was providing, and I'm not throwing everything on their shoulders necessarily, but you could tell where, I don't know, like where, adequate supervision was being provided, emotional support, reflective supervision, all those things were being provided based on our turnover data, because working in child welfare is a high turnover environment, not only for people who work for DCS, but also people who contract with DCS. We're working with the same people. And you could see like the type of leadership that either a direct supervisor was providing, or the amount of supervision based on how their team was performing. They tended to, those staff tended to stay around longer. When you walked in the office, you could kind of just feel the difference in terms of just the culture. But then also, when I would sit in on supervision groups and stuff, like the type of supervision that was happening was different in those type of teams. So you definitely don't have to be the leader of an organization to influence what's happening around you. Obviously, for things to happen at a systemic level, that's really important that you have buy-in on every level. But I think remembering and try to identify what we can do within our sphere of influence to positively impact not only our organizations, but more importantly, if we're taking good care of our people who work at our organizations, then we're going to be able to take even better care of our clients.
Yeah, and Chad, you really hit on probably the 2 points that I was going to make, which were, really making sure if you want to make a systemic change, you need that really total buy-in from everybody on your staff. And then the one that is so important to me goes along with number 5, that secondary trauma that in schools runs rampant, and just, making sure that you're caring for your staff and you're recognizing that and you're talking about it and you're talking about self-care and you're doing things that show, that you recognize that your staff is going through these things and you are doing things to try to help. That was something that was very important to me as a school administrator, because I could see it. I could just see the toxic levels of stress that so many people on staff were dealing with. And that's just a really hard thing to watch in an organization.
Yeah, and really from an organizational standpoint, there was a story that there was a consultant my agency worked with to implement an evidence-based practice at our agency, and they were telling a story of basically someone that was a close colleague of theirs who was running an agency very similar to ours, in that they had a major turnover issue because of the vicarious trauma and just the nature of the work. What they did to combat that was they really tried to invest heavily in their direct line supervision. in terms of making sure that they had plenty of supervisors, that they were well trained and well supported. That way they were able to work effectively with the direct care staff, the staff who were out there visiting the homes and doing, you know, the casework, the supervised visitations, the therapeutic interventions. And they found by investing in that layer of the organization, and it was because, you know, the executive level was trauma informed. That's why they chose to do that. They found that they were able to significantly cut down their turnover problem, and had grown exponentially as an agency in terms of being able to serve clients and the reach that they had. So, you know, I think a lot of times the supervision level is a really important, critical point of becoming a trauma-informed care agency in terms of where to devote, you know, attention to, in addition to trying to raise the level of competency of our direct care staff, is definitely that direct care supervision. I know Indiana DCS, one of their big recommendations when they had an agency come in and study the system was basically making sure that people were getting adequate supervision. The supervisor to FCM, or family case manager ratio, was a big factor. And, you know, I don't know if all the data is in terms of the whole impact that's having, but I think that the preliminary data was showing that was a very positive development. So, so that would be another thing I think I would really emphasize, is kind of taking a look at that level of an organization. And if you're in that position as a team leader, direct line supervisor, is just recognizing how important what you do is, and how impactful that is.
Just being in tune with staff. I don't know if you all have experienced the community check-in. So 3 questions, 3 simple questions that can be done very quickly to kind of gauge, you know, how people are feeling. So it's, how are you feeling? And the person uses 1 word to identify feelings. And basically, what is your goal? So what is your goal for today? What is your goal for this meeting? And then the 3rd question is, who will you ask for help if needed? So, you know, that is a quick way to gauge how employees are feeling, how children in schools are feeling, you know, so you know, maybe I need to have some extra sensitivity today because, you know, they're in a place. So let me do what I can to make them feel that level of safety and comfort.
I love that, because it's reflective, because it helps the person who's in the meeting or whatever it is, for, you know, the social worker who's asking the question or whomever, but also teaches our staff or our clients to be reflective themselves. And that's a key ingredient that we see with being trauma informed, is that not only just having supervision, but that supervision is a reflective style versus a installation style where, you know, like a heavy advice giving, or, you know, kind of getting on to people because they didn't meet a deadline or whatever, like, but reflective supervision, and then reflective intervention as well. I love that. I might have to steal that one.
Steal it all. I stole it from somebody else. This is all of our process of learning. So, wow. I mean, I have learned so much from you all today. And I think, you know, it's great that we were able to talk about, you know, across the lifespan, because, you know, even though there are a lot of similarities, there's so many differences to kind of keep in mind as well, at each age level and everything. So I think it's been amazing to connect with you all and really talk through some of these things. I learned some new strategies myself.
I agree. It's been a very interesting and enlightening conversation. You know, especially since my sphere is really, you know, pretty focused on kids. So to really have the opportunity to stop and think about, you know, what this looks like as, you know, the kids that I work with grow up into adults and older adults. So I appreciate everything that I've learned from each of you today.
Likewise, it's so exciting to hear kind of like what is happening, like in, you know, the different, you know, agencies and systems and things like that. And like, I think it was Lori, you said something about like, oh, this, or someone mentioned that like trauma-informed care as being a buzzword, but it is not a buzzword. It's something that really seems like it's got some cachet, it's going to stick around. And because we see that it works. And I think that's the important thing is, you know, I feel like we're getting closer and closer, hopefully, as a profession and as humans, you know, to try to understand why we do what we do and how we can help other people grow and develop past that. So, yeah. All right. Well, I guess maybe this would be a good time to let people know that if you have any questions for any of us based on things that we were talking about today, that you can reach us. We have our contact information up here on the screen. And I'm sure any of us would, we'd all be happy to answer any questions that you all might have. And greatly appreciate the opportunity to be able to have this conversation, to share with you all, and of course learn together as well.